What should we know about you?
So my name is Maria Trusa, and I am someone that is extremely passionate for helping. I feel that I was born to help. And at this stage in my life, I feel completely blessed that I wake up with a purpose every day. So I've been in healthcare over 30 years, and I decided in 2015 to leave an amazing job. Everybody thought I was going through a midlife crisis because who would do that when I just had a vision of what I wanted to do? And my vision was to help the underserved community in the underserved community with healthcare, specifically because that has been my passion for over 30 years. And I decided to open up, and I won't go over the whole story because it's a long story, but in 3 months after leaving my job, I found my business partner who had opened up a medical center, and I joined forces with her, and we started a mission in 2016 to help the uninsured population. So I have a lot of passion for providing dignified care to a community that is not used to that.
So, two things. Was there a moment when you said, this is it? And the second is, what does dignity mean to you?
There was a moment. I actually realized that I was helping a few hundred people, and I realized that there are thousands of people out there that are not getting dignified care. And what does that mean to me? I was privileged to work with the affluent community for 26 years. But I am Dominican. I was born and raised in the Dominican Republic. I have a lot of family members and friends that don't have the means to get the type of health care that I'm used to providing to the patients that for the practice that I was the executive director. And to me, it always bothered me that these patients are waiting in clinics hours to be seen. They have to wait long months to be seen by a specialist. And yet, in my community that I took care of, 15 minutes the patient will wait and they will complain. And in the underserved community, they're used to waiting 4 6 hours in places that is below standard. And in my mind, we want to raise the standard for the underserved community, the uninsured community specifically, because they don't really go to the doctors. And they don't go to the doctor because it's either they don't have the time because they're working and they cannot go and wait hours. And in addition to that, they cannot afford it. They cannot afford going to the places where they can get dignified care. So in my mind, I was going to create a place where the place in itself, when you walk in, has to be beautiful. It had to be inviting. That's part of dignity. The staff has to be welcoming. Hours of waiting, no, that could not happen. Doctors that are qualified, people that care. And I put together with my business partner an amazing place where everybody is mission based. And that is, for me, the dignity has been missing. And that is why we have the results we have in healthcare. There's a high cost, but the high cost is because I don't think, obviously, people are not getting equal healthcare.
So, how did you go about building a mission-based organization?
As you could tell, I'm extremely passionate about my mission. And I started talking to other providers, even doctors in the area, about helping me fulfill this mission. And when I feel them, when people can feel that you are honest and that this is in your bones, that this is what you want to wake up to do every day, they are welcome and they joined. In my staff, we have about 40 staff members already. I know technically when I look at a resume, I've been interviewing people, thousands of people over 30 years. When I look at a resume, I can look at the skills. But to me, I always ask, what makes you wake up every day? And my interviews are more based on what is your purpose in life? Do you know it? What do you like to do? I want to know more about the person. So I've been able to really bring on board all these amazing people that want to help the underserved community, the uninsured community, to get dignified, affordable, accessible health care.
Beautifully put, thank you.
Thank you.
So you could have joined lots of boards.
Yes.
Was there something in particular about United Way that was a fit for you, or not at all?
Yes. I met Alana at a breakfast, and she spoke about Alice in about 211. And I have to say that 211 for me just became this. I'm like, why did I not know about this? Because I am trying to help the underserved community and people to get access to not just healthcare, but if you have a need, I want you to call me and I want to be able to help you. Especially with our patient population, is the underserved community. They have many needs. And what I found myself doing was trying to work with different organizations, different nonprofits, to figure out how I can create a database so that I can guide our patients where to go. And when I heard about 211, I was like, what the heck am I doing? Like, 211 is the solution because I don't no longer have to do that for our patients. I can say, listen, call 211, and they're going to guide you if you have a financial need, if you have any type of need, you are going to be guided through this organization, and they're there every day, 365 days a year, every night and day. So to me, that blew me away. And I couldn't believe that more people did not know about this. And I started asking people, do you know about 211? And no, what is that? So I actually invited Ilana to do a video in my office because I was so passionate about the fact that, you guys have a mission that is similar to my mission. So like you said, I could have joined many boards, but to me, this was one that it's close to my heart because it is helping the underserved community.
So I'm super clear, your essence is passion. If you chose a word in addition to passion to describe yourself, essentially, what would that other word be?
Commitment.
Tell me about that.
I am extremely committed to this mission. I am someone that when I put something in my mind that I know I could impact other people, I get fully committed. We started this business in this mission from nothing. And I realized I come from a place where there was a foundation for me to build. In the practice that I became the executive director, and I was able to create an amazing practice, but I didn't start from scratch. So I realized that I was in such an uncomfortable place. And I always say, when you put yourself in an uncomfortable place, you're gonna have the most growth. And that's what happened to me. So I became an expert of marketing. I started reading books. I got so obsessed about making sure that this mission was going to be successful that I read a book a week. I listen to a book. I do the Audible books, and I do one a week. And people tell me, what? Well, how do you find the time? And I think when you're so passionate about the purpose that you found in life, 4 hours of sleep or 5 hours of sleep become enough, because I go to sleep and I'm like in deep sleep immediately, and I wake up every morning and I'm just happy to be alive and happy to be making an impact.
What is the thing that you have seen in your life or experienced that caused or causes heartbreak? And what is the thing that you've experienced in your life that has you be so joyful?
Oh, thank you. I come from a very humble beginnings. I went through traumatic experiences in my life when I was a child, and I have become. I've been able to take that experience, something that could have turned me into an extremely negative person, and I've made it a purpose when I was 15 years old that I will create a happy life. And I took on this journey that I was going to do everything I could to be happy and to give this energy to my family, the family that I would create. And I have 3 children, and I feel completely blessed because I have very successful kids and happy children. But it wasn't easy. I mean, I really took on a journey and a commitment to my happiness. And I can tell you that, I look at my life in decades, and my 20s were rough. They were really, really rough. My 30s, I realized as my kids were growing that I needed to change, that I needed to find the inner peace, because it was not just for me, but I needed to do it for my kids. So they were my catalyst to an amazing journey of growth in self-development. I went to therapy for 6 years. I read books on self-development. I did gratitude journals. I did everything I could to be able to reach the level of happiness that I'm in now. And I have this inner peace that I talk about it, how I would love to be able to inject it on people. Like when I see people suffering and I connect with the suffering, because I did go through major pain in my life. And when I see that, I just want to figure out a way to impact them and change them and give them some of this energy.
Can you just say for everyone the name of your amazing organization and where it's located?
Yes. So it's Forme Medical Center and Urgent Care. And our mission is to help the uninsured community. And we're located on 711 South Broadway in White Plains, New York.
And I'm going to have the privilege of visiting you soon.
I'm so excited.
Is there anything else you want to say?
I think, we all have to give back. I always say that if we had more mentors in life, that we could really help, especially for me, mentoring women. I do this with women that come and ask me, can you mentor me? Can you mentor me financially? Can you help me figure out a way to find that inner peace that you have? And what I challenge people to take on and be mentors, because we don't have enough. I was in a room full of powerful women at a meeting, and I said, how many of you have taken a woman, that I used to do this for Westchester Community College. I was on a mentoring program, and I used to love having one of the students come and just be side by side with me for a month or so and teach that person how I navigate the system, how the things that I learn, and not just talking to them, but them seeing me, shadowing me. And I need to, this is something that I want to do. I want to encourage powerful people to give back by becoming mentors.
Thank you.
Thank you.